Through you, Madam Speaker, a few comments and a few questions. First of all, I'd like to thank everybody who had worked on this on a bipartisan manner to bring the amendment that's before us tonight. The good representative sitting next to me, Representative Oler, and myself, had a chance to attend the Litchfield County Opiate Task Force last month. And the task force took this language, and they understood this language, and they liked this language. And I just wanted to thank the McCall Center for Behavioral Health, Northwest Center Prevention Network, Charlotte Hungerford Hospital, Greenwoods Counseling, Department of Mental Health and Addiction Services, Sharon Hospital, and Northwest Connecticut Community Foundation. They were all there. They all heard the amendment. This is a very difficult problem we have. And as the good representative who brought it out, I think he stated it very well in his comments. We have people dying every day. And we need to find a solution. And I think this amendment, with working with many colleagues and the ranking member, Betts, we tried to look at the Massachusetts model and follow along. And I think there was a working group also put together with Representative Carpino was on there and a few others. And the Massachusetts model is voluntary, and I think that's what we go off here, is voluntary. So through you, Madam Speaker, I'd like to ask a few questions, or multiple questions, to the proponent of the amendment.
You may proceed.
Through you, Madam Speaker. So in the previous comments, the good representative from Waterbury, she had some concerns. So in this legislation, I think in the last few lines, we'll just skip down there, but this is a voluntary registry through you, Madam Speaker. Is that correct?
Representative Steinberg.
Through you, Madam Speaker, that is correct.
Representative Case.
Through you, Madam Speaker. So if one decides not to register, and let's say they don't call themselves a sober home to get away from this legislation, but they call themselves a clean living home, that's still permissible. Through you, Madam Speaker, is that correct?
Representative Steinberg.
Through you, Madam Speaker, that is correct.
Representative Case.
Thank you, Madam Speaker. So, through you, Madam Speaker, I believe it was stated that the state of Connecticut does not have a chapter of NAR. Is that correct, through you, Madam Speaker?
Representative Steinberg.
Through you, Madam Speaker, that is correct, but there's an expectation that situation will change shortly. Through you.
Representative Case.
Thank you, Madam Speaker. And once there is a chapter of NAR in Connecticut and somebody who has one of these sober homes wants to be registered so they can be part of Department of Mental Health and Addiction and get their name on the website, what is the cost to do that, through you, Madam Speaker, for a particular home?
Representative Steinberg.
Presuming that the NAR affiliate in Connecticut is similar to those in other states, there is a modest annual fee, I think, and I have to look it up, but in a matter of the hundreds of dollars. Through you.
Representative Case.
Through you, Madam Speaker, and to the good chairman, is that an annual fee, through you?
Representative Steinberg.
Through you, Madam Speaker, indeed it is an annual fee, and I should amplify further. There are additional costs per bed in the facility depending upon the level and quality of that particular facility. And there are some fine distinctions between such levels. But overall, it's not really a great expense as much as to basically cover the cost of administration. Through you.
Representative Case.
Through you, Madam Speaker. So there is a modest cost and you have to follow some guidelines. Through you, Madam Speaker, what is the incentive for somebody with one of these homes to actually become certified? Through you, Madam Speaker.
Representative Steinberg.
Thank you, Madam Speaker. And I thank the good representative because this may be really the central question of the entire import of this legislation. It may not be true today, but it is our objective to create a clear distinction between real sober homes and those other things that are out there. That by seeking certification, maintaining the quality that is inherent in certification, and registering with the department site, that the real sober homes will benefit from having more people seek them out then seek out the other housing arrangements. And that those that are currently not qualified to be certified will recognize the distinction that the business is going elsewhere and will choose to upgrade their facility and the quality of it so they too can qualify as sober homes. That's our objective. What we really hope is that the bad ones melt away and cease to be, and the risk with them, through you.
Representative Case.
Thank you, Madam Speaker, and I thank the good chairperson. I'm just trying to look into, because, this is what we want. We want good care for everybody. And, there is the chance of, these homes still being out there, and we're just trying to work through the difficult challenges of the fair housing laws and what have you. So, through you, Madam Speaker, is there any funding available once they become certified through the Department of Mental Health and Addiction Services to help pay for these people to be in these homes? Right now, I believe majority of them are cash paid. Through you, Madam Speaker.
Representative Steinberg.
Thank you, Madam Speaker. The good representative is correct. Currently, the vast majority of those who are in sober homes are there on a cash basis at their own expense to a large degree. Ideally, and particularly if we want to get our arms around the substance abuse epidemic that this country and this state faces, we'd have a lot more available resources to subsidize or assist with these people. And obviously, a lot of our focus within the department is on treatment. We'd also obviously like to be able to access any federal funds that might come available, but as you know, that changes almost year to year. So I don't want to overpromise. I want to suggest that most of the people who are in these sober homes are going to have to be very self-reliant. Through you.
Representative Case.
Thank you, Madam Speaker, and I do agree with the good chairperson. He explains that very well, and it's a shame that that we do have programs that help people get out of addiction, but their length of time to stay in these programs in these hospital situations is limited due to the amount of dollars in the insurance and what it pays, and that's why people get out what I believe is too early and too soon, and then they move on to these homes, and this is what brings them to a different part of life. So I thank the good representative on the possibility of federal dollars and others that have come through, because I think that would be an incentive for people to do this. I think a lot of people choose to go to these homes, not only because they're there, but because some of them don't want to be known that they're there. And if you're inclined to be in a certified sober home, you could be on a registry that you're there. I think this legislation is a beginning to where we want to go. We needed to have a start. My question through you, Madam Speaker, if the good representative knows, because I've been trying to get this, I have many answers, what is the stay in a treatment facility before you go to a sober home? What does the state of Connecticut allow and pay for? Through you, Madam Speaker.
Representative Steinberg.
Thank you, Madam Speaker. It's a very challenging issue for not just the state of Connecticut, but any state that seeks to provide treatment to people, citizens of their state. Frankly, because of the breadth of this epidemic, most states are not in a position to have sufficient funds available for treatment. And I should also note that the treatment period for any individual may be limited by the funds available, but their particular experience will vary by individual. So to the good representative's question, there's no assurance that the treatment regimen that might be available will be sufficient or a proper length to meet the need of that individual before that treatment must end and they must find other options. It's one of the great challenges we face. Through you.
Representative Case.
Thank you, Madam Speaker. And just to mention, it's such a problem in the Northwest corner that if you look at the 20 towns just in the Northwest area, there's 4 treatment facilities. That's how necessary this is and what a problem it is. And those people obviously can come from all over the state, but it's really become an issue in the number of beds that we have for treatment. Some would say there's not enough. I believe there's never enough when it's taking care of people. So through you, I'd just like to ask a few questions, and then I'll close it up here. So the only way, because I know the good representative from Waterbury talked about Narcan, and the only way those regulations come in where you have to have two sets of Narcan in the house, certification in the house, those only come into play once they become certified. Through you, Madam Speaker, is that correct?
Representative Steinberg.
Thank you, Madam Speaker. I would agree that that would be the base expectation for any home seeking certification and registration with the department. But I would hope that any home, whether certified or otherwise, would certainly consider having Narcan available on premises. Through you.
Representative Case.
Thank you, Madam Speaker. And I thank the good representative for that. I believe that, we work to have our cops, our schools, and everybody have this so that once you can save a life really quickly, and then hopefully that person can move on and better themselves. Through you, Madam Speaker, with this certification, do we look for to have certified staff on board in these homes to help people through their sobriety? Through you, Madam Speaker.
Representative Steinberg.
Thank you, Madam Speaker. I appreciate the question. I think we need to be very clear about what certification requires. It does not, in this instance, as NAR requires for certification, involve certified staff, per se. The certification has a number of requirements as to the general supervision, but I'm loath to use the phrase certified staff to give the wrong impression. Through you.
Representative Case.
Thank you, Madam Speaker, and I thank the good representative once again, because when we're looking at the Massachusetts model, I think once they came out and they did the voluntary certification, I forget the number, I think in the first 6 months or so there were 112 homes that certified. Not sure of what their certification was or what dollars were available to them, but people jumped on board on the voluntary certification. Through you, Madam Speaker, so I know the Department of Public Health and Addiction Services has been involved. How are they, and have they had input on this amended legislation? Through you, Madam Speaker.
Representative Steinberg.
Thank you, Madam Speaker. A good question. I should state at the outset that the department, DEMIS, has been at the forefront of dealing with this problem of addiction, as they should be, and has already done many wonderful things and continues to do so to address the problem, frankly, with very limited resources. They have been party to this conversation from the outset. They have been very good counsels in expressing the limitations of what we as a state can handle, and I think we can count on them being good partners going forward. Through you.
Representative Case.
Thank you, Madam Speaker, and thank you to the good representative and Chairman of Public Health. We have a difficult population here, and I think we're taking the first step here in order to go positive. It is voluntary. There aren't many teeth in here, but we have to start somewhere. We have to find a way to break through the challenges of once somebody goes through a treatment and wants to gain sobriety. The bottom line, too, is that it is up to the person that wants to stay sober, but we all know there's sometimes the demon or the person within you that doesn't allow that to happen, and those are the people that need a good, sober-style living home. I do appreciate those and all of us who have worked together on a bipartisan way to bring this legislation, and I do thank the good Chairman of Public Health for all his answers and for working through this very difficult piece of legislation. Thank you, Madam Speaker.